As a veterinary professional, you know that periodontal disease is a silent epidemic among pets. Without early detection and appropriate treatment, periodontal disease may lead to the development of serious problems that can decrease the quality of life for your patients. These problems include severe pain and loss of teeth, which can result in the inability to eat. Periodontal disease may also lead to life-threatening illnesses, including heart, liver, and kidney diseases. Introducing OraStrip Quick Check, a simple, quick, and accurate test strip which detects and monitors periodontal disease activity in dogs by measuring the extent of periodontal infection.
The difficult thing is you can look in the oral cavity and it appears fairly normal, but the reality is there's a lot of disease underneath the gum line, kind of like the iceberg effect. So that's the thing, is that they don't recognize the disease. Oftentimes veterinarians underestimate the disease level too, and it's not until we get them under anesthesia that we really are able to tell that with dental radiographs and oral exam.
Periodontal disease is an active infection of the gums caused by anaerobic bacteria. These bacteria produce metabolic products called thiols that can disrupt gum tissue and induce bone loss. OraStrip Quick Check detects and monitors periodontal disease activity by measuring the extent of periodontal infection by directly measuring the concentration of thiols from the gingival margin. In clinical studies, high strip values indicating an active periodontal infection were associated with radiographic evidence of progressive bone loss, which occurred in the absence of clinical manifestations during routine visual examinations. Additionally, disease was underestimated by clinical observers in dogs presenting with varying degrees of visual inflammation and gingival recession, further evidenced by progressive bone loss and disease activity detected by use of the strip. OraStrip test results increase client awareness and prevention of periodontal disease by increasing compliance for veterinarian recommendations for professional cleanings and home care. Using OraStrip is simple. As you remove OraStrip, be careful not to touch the pad at the end, as it may contaminate the results. OraStrip can be used on a dog while awake or anesthetized. Lift the dog's upper lip, and while supporting the pad end of the test strip with the index finger, gently glide the pad against the entire maxillary buccal gingival margin. The pad should gently glide along the gingival margin so as not to cause bleeding, which will interfere with the result. Excessive pressure on the gum can dislodge plaque, which can also obscure the test result. Once the sample has been collected, remove the test strip from the dog's mouth and wait 10 seconds before reading the results. For optimal results, read the OraStrip Quick Check within 5 minutes of sample collection, as color on the pad tends to fade.
The other thing that the strip does is it creates some urgency and it legitimizes a veterinarian's recommendations. Sometimes the client is skeptical that the animal really needs to be put under anesthesia, that he needs full mouth x-rays, that they need to spend $500 for the treatment. When they see that swab, they understand that there really is some other source telling them that that needs to be done.
To read the results, make sure you're in a well-lit area. Hold the OraStrip Quick Check test strip near the colors shown on the color comparator card provided. Determine and record the number on the chart that's nearest the closest matching color. If the color on the pad is not uniform, base your decision on the most intense color seen on the pad. It's important to note that non-uniform results may occur if the gingival tissues are very dry or if disease activity is unevenly distributed or highly localized. Interpreting the results is easy.
It's very easy to understand, very easy to read, very easy to show the client. They don't have to have much prior knowledge.
The occurrence of a color reaction, such as a 1 or above on the comparator chart, represents the presence of thiols and is most frequently associated with active periodontal disease. No color reaction, represented by 0 on the comparator chart, represents undetectable thiol levels and is not associated with active periodontal disease. Because periodontal disease is a chronic disease, OraStrip will track and monitor disease activity, providing a first warning sign of an active oral infection. OraStrip provides a visual, rapid test result to show your client. With OraStrip, you can quickly detect and recommend dental services and treatment for underlying periodontal disease activity that may be undetected or underestimated by a routine clinical visual examination. Try OraStrip Quick Check today and remind clients that a healthy mouth helps maintain a healthy body and a better quality of life for their dog.
The great thing about the OraStrip is that it identifies disease early on so that we can catch it before it progresses to periodontitis. And so that's where I see the real benefit in our practice situation, is that we can help these animals from actually developing the disease, and we may not recognize it visually. So the effectiveness of the OraStrip really hit home with our own personal dog. It's my daughter's dog, actually. And when I looked in her oral cavity, it looked like she simply had gingivitis. But when I did the OraStrip, we got a high reading. So I put her under general anesthesia and of course found that she had some pretty significant periodontal disease along her mandibular incisors. And of course my daughter was not too happy when she found out that she actually had underlying periodontal disease, and I was a little bit embarrassed. So all of our animals will be using the OraStrip on a regular basis from here forward.